Hello, my name is Colton Ford. Today is 10/15/2022. I'm going to do the Module 8 video recording. Here's my note card. Nothing on the back. So we had to pick a system and talk about specialists regarding to that system. I chose the integumentary system, so I'm going to be talking about the skin and its appendages and the specialist pertaining to that. Okay, so first, let's just talk about the skin. The skin and its appendages is really the most superficial layering of the body. Um, any direction that any view that you take of the body, you're probably going to see skin or its appendage, since it is the superficial coating of the body. Whether you look at the anterior surface of the body, you're going to see skin. If you look at the posterior view of the body, you're going to see skin and its appendages. The lateral view of the body, or even looking more medially on the anterior or posterior aspect. Even looking from a superior view or a inferior view, you'll see the either terminal hairs of the head and the skin of the shoulders, or from an inferior view, you'll see the soles of the feet. Now, what is the function of the skin? As we know already, the skin serves as a protective layering from environmental hazards, helps reduce friction for more vital cells beneath the skin's layer. The skin also serves a vital role in the storage of fat, the synthesis of necessary vitamins such as vitamin D, and even serves a role in immunity, since the skin has Langerhans cells which will assist the immune system. Now, anatomical landmarks of the skin. This one's a little more tricky, but there are several landmarks of the skin that we can look out for. We have starting from the top, we can talk about some of the appendages. The terminal hairs, the dense collection of terminal hairs on the scalp aspect of the head, including the terminal hairs of the eyebrows or the pubic area as well. Another feature that we will see is the nipples. This is a unique skin feature that we can see on the anterior aspect of the thoracic area. Sorry, excuse me. Then we have the navel or belly button. That's another feature that we can see. Following that, we have the distal nails, which are appendages on the distal phalanges of the hand or the feet. The nails are located there. Another thing that we can find on the hands and the feet would be pertaining to the thick layer of skin of the palms of the hands and the soles of the feet. But more visibly, we can see dermopapillae, or like fingerprints, and these are found on the bottoms of our hands and the bottoms of our feet. And I believe that covers all 5 features, anatomical wise, of the skin. And now we'll talk about the specialist. Specialists for the integumentary system are generally referred to as dermatologists. Now there are several different types of dermatologists. We have your medical dermatologists, which are going to be helping with things more like the overall well-being of the skin, such as helping treating acne or psoriasis with medications. We have cosmetic dermatologists, which is more focused on the overall appearance of the skin. So they help with things that may be related to such as wrinkles, sunspots, or scarring, and they might help provide things such as chemical peels or other cosmetic procedures to help improve the appearance of the skin. Now we have another little subspecialty of dermatologists, or pediatric dermatologists. Dermatologists overall can still help treat younger patients and children. However, children are more predisposed to certain medical conditions, which having a specialized pediatric dermatologist will be more knowledgeable on and are more inclined to better treat these more common symptoms for children. Now we're going to talk about the final, not the final, we'll talk about another specialty of dermatologist, or another type of dermatology, and that is just kind of your procedure or surgical dermatology. These dermatologists will perform invasive and non-invasive procedures to help treat things such as benign tumors or skin cancer. A common type of this is a Mohs surgeon, and this is a type of surgery for skin cancer where they scrape or remove thin layers of the skin cells and they examine until these cancerous cells are no longer visible. And it's a unique type of surgery where the doctor can actually see where the cancer cells stop becoming visible, and you can kind of see where the cancer cells kind of are cut off from normal healthy cells and cancerous cells. Lastly, we have a specialty called, or a type of dermatologist called a dermatopathologist, and this is more focused on the histologic aspect of dermatology. They will use microscopic examination techniques to look at skin, to look at pathology, and other things such as cancerous growth or any other pathologic problem of the skin on a more histologic microscopic level. Now that covers everything I believe that was required for this video, so thank you very much and have a good day.